Hello, I'm Gavin Nyman. I'm an orthopaedic surgeon specialising in shoulder surgery, and I'm here to tell you about rotator cuff repairs. Rotator cuff repairs in my hands is done arthroscopically, that is through minimally invasive techniques or a telescopic technique. What is an arthroscopy? Well, an arthroscopy is an operation used to inspect the joint of an area of the body. In the shoulder situation, it's set to inspect the shoulder joint, which comprises the socket and the ball, which is known as a glenoid, and the humeral head, both inside the shoulder and then on the outside of the shoulder where the tendons lie. What techniques can be treated, or what problems can be treated in a shoulder arthroscopy? Well, first of all, we can address the shoulder joint and look at the socket and the ball and see if there's arthritis there. We can look at the tissues around the socket called the labrum, which help extend the socket. We can look at the biceps tendon, which attaches on the top of the socket, which can be inflamed. We also look at the undersurface of the tendons to make sure they're not torn from the inside. And then we go on the outside of the shoulder and look at the outside of the surface of the tendons to see if they're inflamed or torn from the outside. We can then clean away the lining of the tendon, called the bursa. We can shave away the bone, which might be catching on the tendon, and that's called a decompression, shaving away a subacromial spur. We can also look at the AC joint area to see if there's arthritis. And if there is, a small segment of bone can be taken away to stop the two bones rubbing together, and that can be treat the AC joint arthritis. Finally, if there's a tear of the tendon itself, this can be repaired using arthroscopic techniques. Thus, with either 3 or 4 small incisions around the shoulder, I can do all these procedures. What does a shoulder arthroscopy involve? Well, it involves being admitted to a hospital for an overnight stay. Usually the patient will have seen the anaesthetist beforehand, but if the patient is otherwise fit and healthy, they may see the anaesthetist just on that day. The anaesthetist will talk to yourself, if you are undergoing the procedure, about what sort of anaesthetic you would like. Often the anaesthetist will ask whether you'd like an interscalene block. That involves a little injection at the base of the neck, and it numbs out the nerves going to the shoulder and the arm. It does have the side effect of leading to a dead sensation in the arm, such that the arm may feel dead when you awaken from the procedure, but also reduce the amount of pain you experience, and thus you can have a lighter anaesthetic and less complications associated with the procedure, i.e. you awaken without feeling quite as nauseous. The disadvantage is that when the block wears off, the pain often will be present and come back for a few hours with a little bit more vengeance, but this can be treated with analgesics. Consequently, through a light anaesthetic or general anaesthetic and a block, patients can have a procedure which allows them to go home the following day and back to their own environment. What does the operation actually involve? Well, I've got a model here which may explain it a bit better. It's always hard to see from a model, but this is a patient with their chest wall and their arm. You'll see in this model we have plastic overlying the shoulder joint. This is actually a model which was initially used to train myself many years ago, and for which the students will practice upon. The patient is positioned on their side. After being placed asleep and having the interscalene block put in, they're positioned on their side, and their arm is placed in traction with about 10 pounds of traction, just to distract the joints slightly. This allows the shoulder to open up. Then a telescope is placed through the back of the shoulder into the shoulder joint through a small little incision. Instruments then can be placed through the front of the shoulder, and we'll often use a class A cannula, such as a little device which allows instruments to be passed through readily without having to push on the soft tissue. So this is placed into the front of the shoulder to allow instruments to come in and out from the shoulder. We use a little device called a diathermy wand, which is used to clear away the soft tissues from the underlying of the bone. So once we've looked inside the shoulder joint, using several holes and using probes, we can then use this device to clean away the undersurface of the bone, to expose the bone to allow us to shave away any bone that's catching in the shoulder. The operation takes about an hour to an hour and a half, and I like to inspect the joint thoroughly and make sure we've treated all pathology at the same time to avoid the chance of having to return for another procedure. And my return rate for surgery in generally is extremely low. I like to get it all done on the one occasion. Post-operatively, the patient will awaken. If they've had a repair of any tendons, they'll need a sling for a period of time. If it's a small tear, it's a four-week period in a sling. If it's a larger tear, it's a 6-week period in a sling. They'll still come out of the sling to wash in their armpit, to do exercises, and they can do very simple activities in that sling. In the vast majority of cases, the sling is not required, in which case we encourage mobilisation straight away, asking the patient to help use their other arm to help push up straight away to full movement. The patient's discharged home the following day after surgery, and they'll be reviewed on a regular basis, initially 8 days after surgery for removal of sutures, and then on a regular basis until I'm satisfied they're making progress and actually getting a good result from the surgical procedure. In this way, we can be happy that we've done an extensive procedure all through small minimally invasive technique for an overnight stay, and I would say the success rate in such cases ranges between 90 to 95% depending on your scenario. Unfortunately, no operation can have 100% success, but I'm meticulous in trying my best to get the best result for yourselves. Please look at other videos for further information about different surgical procedures, and we'll go through these in more detail. But I hope this has explained what surgery involves for rotator cuff repair. Thank you very much.